Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Rae Cowen, who is a licensed marriage and family therapist at Family Practice Associates. Welcome.
Thank you.
Well, let's start out briefly. What is a licensed marriage and family therapist? What do you do?
Sure. What do I do? Well, most of the day I talk to people about things in their lives that are hard or bothering them. We would be equivalent to a licensed professional counselor or maybe a licensed clinical social worker. So we're all educated similarly, but LMFTs are unique in that they're educated with a systemic perspective. So we're really thinking about each person and each unit, whether that's a couple or a family, in the context of their community, their culture, kind of their time and place and how they exist. So mostly I do therapy.
Well, speaking of that, so the holidays are coming up.
Yes.
And holidays are supposed to be good, but sometimes there's some stress.
Sometimes there's some stress.
What causes it?
What causes holiday stress? Lots of different things. One of them is unrealistic expectations. So really having in your mind this vision of what the holiday needs to look like or what it needs to feel like, which is sometimes not very realistic. Sometimes family dynamics can cause holiday stress if there's conflict that's unresolved between people or disagreements that are kind of chronic in families. And then I think also, loneliness. People who are grieving, who've lost loved ones, might be dealing with their first holiday season after that loss and aren't sure what it's going to feel like or look like, but know they're going to miss their person.
You mentioned families, and sometimes there's family topics. Are there things you do talk about or don't talk about that might present stress at the holidays, and how you manage that?
Certainly. Well, I think those expectations are something that should be talked about and maybe aren't always talked about, right? So what are our roles and what are our responsibilities in this family, and especially around holidays? We have events, we have gatherings, people are coming together, and so everybody has their own idea of what should be happening there and who's going to do what and take care of these things. So I think expectations are something that we don't always communicate about, that we should communicate about. And I think our boundaries and our needs with each other also. So sometimes one person ends up with a lot of the burden of a gathering or an event on them, and they haven't said to their family members, "Hi, I need some help. Can you bring this? Can you do this? Can you take that off my to-do list?" So those are some things that I would encourage people to communicate with their family members about.
So how do you know that you're stressed or you're anxious?
Yeah.
What are some symptoms that might think, oh, this is not good?
Yeah. Holiday stress is very similar to normal stress, the things that you feel when you are stressed out. So you would notice maybe changes in your mood. You don't feel so good, you feel more irritable, you feel more fatigue or kind of lethargic. You might notice changes in your energy level. You just don't have the get up that you usually do. You might notice sleep changes. Either you're sleeping a lot or you're not sleeping very much, or appetite changes. You're not hungry or you're hungry for everything. You might notice changes in alcohol use or substance use, maybe using alcohol to cope with the extra stress of the holidays. Those are some warning signs to look for.
Now, you mentioned some ways to manage stress. You mentioned boundaries and expectations. Are there other things that you might want to look at doing?
Yeah, I think for a lot of people, getting really clear about what the holiday means for you. So what matters? Why are we doing this? Why do we kind of agree to these expectations? Is it because we value togetherness? Is it because we value connectedness? Like, what's the driving force of us doing these things? And once you've clarified that, build your expectations around that and communicate around that. So lots of families, lots of groups have traditions around the holidays. Ask yourself, am I doing this because I think I'm supposed to, or am I doing this because it means something to me? And if it means something to you, then let's get what we need to make that happen. And if it doesn't, maybe we renegotiate or compromise.
Now, you mentioned some physical things like drinking less, setting boundaries. Are there other physical things that you may want to do, like Is exercise helpful?
Exercise is always helpful, Dr. Fox. You know that. Moving your body obviously helps reduce that physiological aspect of stress. So does eating well, right? So watching your alcohol intake, eating food that fuels you, move, yes, get up, walk. Maybe you build that in as a tradition. We sit down, we have a meal together, and then we take a family walk after that.
Sounds good. Well, we thank you for coming in. We thank you for all you do, and thanks for helping us with our stress during the holidays.
Thank you so much, Dr. Fox.
All right. We'll be right back.